Ambulance transport services with the Rapid City Fire Department have been serving the community for 20 years.
As the area has grown, so has the department and EMS. In tonight's Eye on Kettleland, Sydney Thorson takes a closer look at just how much the ambulance services in Rapid City have come over the years.
Rapid City's fire department took on ambulance services in 2003. At the time, the department had about 6 ambulances. Now the paramedics have 14 of them.
During these last 20 years, we've had a lot of growth. We've had a lot of positions that we've had to add to our department, not to mention countless hours of training and recertification, making sure that we've got the best equipment and the best vehicles that we can have to be able to provide that service.
Denise Rossum is the fire department's patient billing services manager and was around when the first emergency calls came in. She says it was a very exciting day and a busy one.
There were only 2 of us in that billing office, and we listened to the calls as they came in, and we knew that the next day our paperwork would arrive, and from that moment on, it's been busy and things never did slow down after that.
Back in 2003, when the ambulance services first started with the Rapid City Fire Department, the busiest station got about 8 to 10 calls per day. Now today, that number has grown about double. Brent Long is the fire department's division chief of ambulance operations. He says he is proud to see the growth of the ambulance services over the last 2 decades.
We don't use tax dollars to do this, so it's whatever we can do to collect from our service to be able to keep this operation alive, and it's working.
In 2003, the Rapid City Fire Department was made up of about 90 personnel. Today, that number has grown to about 145.
Well, the emergency services have grown and changed, and resources have been added, and it's incredible to see the dedication to the community and see how everything has evolved to bring in the new services to be able to provide the best service we can.
Since then, the department has built many relationships with the Rapid City community, including Monument Health Hospital.
It doesn't seem like it's been that long. We were just talking about how we remember the first day that they took over the service and they came in, and it's like, that can't have been that long ago, but yeah, it was. So it's cool that we have that small community with the tight-knit relationships, and like I said, there's still lots of us here that were here when this transition happened.
By working closely together, the hospital and ambulance services are able to provide the community with the emergency care it needs.
We work together on a lot of things. Obviously, they're our primary EMS service in our area. So when we went through COVID together, we worked on practices that we would both be utilizing, how they bring the patients in, how we receive them. They went through our construction project with us.
With a supportive community, loyal employees, and great leaders, the department is hopeful for the future.
Right now, sky's the limit. We're finally starting to get some traction with some of the bills that are going through out in Pier right now. Getting just some of the retirement stuff to try to attract more people to come into the EMS field. Changing how we're able to collect some of the revenue to be able to keep ambulances open, for one thing, is the biggest part.
I look forward to the next 20 years being the same, continue to grow and evolve.
With Eye on Kettleland, I'm Sydney Thorson.
Now, if you would like to join their team, they are hiring. Just check out their social media pages for details.